Today we will be discussing skull identification, the second part of our learning unit. Last week we talked about the bones of the skull in various views, and then we also talked about the 8 cranial bones. Today we will be talking about the facial bones, which are also referred to as the visceral cranium, which is the portion of the skull related to the digestive and respiratory systems. The mnemonic to remember the 14 facial bones is many men venture past Indians near Zygoma Lake, lake being lachrymal, zygoma, zygomatic. Note the asterisk after the palatine bones. Reason being it's considered a facial bone because you can see a small portion of the palatine bones in the apex of the orbit. Let's look at all of the different facial bones. We'll start with the maxilla. Different landmarks we want to be familiar with is the canine eminence, which is the prominence of bone over the root of the canine. So if you were to put your finger on the gingiva above the canine, on the root there, you'll notice that it comes out. It's very prominent. That is the canine eminence. Now if you go lateral to that canine eminence, so remember medial would be towards the midline where lateral is the opposite side. So you want to go lateral to the canine eminence, you can find the fossa. Fossa means a small depression. And that is very important for a landmark when providing local anesthesia. There's the infraorbital groove, canal, and foramen. The infraorbital foramen, as you can see right above the word maxilla, that's where the infraorbital nerve exits. When you think of intermaxillary suture, remember a suture is made of connective tissue. It joins the anterior surfaces of the right and left maxillary bones. Different landmarks here you want to make note of. I had mentioned before the incisive foramen. That's important with local anesthesia. That's where the nasopalatine nerve exits. The greater palatine foramen is another area when you're giving a greater palatine injection that is going to anesthetize the soft tissue of those molars in that area. When we talk about alveolar process, remember we're talking about the area in which the bone that your teeth sit in. So if it's inferior alveolar, we're talking about the mandible. Superior alveolar, maxillary. Okay, let's talk about the mandible. The mandible, or the lower jaw, is a single bone that is the only freely movable bone of the skull. It is the largest and strongest facial bone. The mandible has a movable articulation with the temporal bones at each temporomandibular joint. So the ramus is the horizontal portion, angle is the junction of the body and the ramus, and the body is the horizontal portion. Okay, I am going to go through some of the landmarks of the lateral view of the mandible. We've already talked about the body, alveolar process, ramus, and angle. The mental protuberance is the bony prominence of the chin located beneath the roots of the mandibular incisors, and it's more pronounced in males. So if you were to take your index finger and just wrap it around your chin, that area that is most prominent, that is called your mental protuberance. The symphysis is at the midline, and that is where the right and left fuse together in early childhood. Remember, the mandible is one bone. External oblique line is a radiographic landmark. The external oblique line is a crest where the ramus joins the body of the mandible. The retromolar triangle is located just posterior to the most distal molar of the mandibular dentition. This bony landmark is covered with soft tissue in the retromolar pad of the patient. So again, if you were to put your finger in your mouth, go to the distal behind that last molar on the mandible, that soft tissue pad there is called the retromolar pad. The retromolar triangle is the bony area right underneath. Mental foramen, that is where the mental nerve opening is. It's below the second premolar. Some books will say that it's between the first and second premolars, but it's right in that area. Remember, every person varies a little bit. There is variation, and again, different books say different locations, but you want to look in that area. The condyle of the mandible is a projection of bone from the ramus of the mandible that participates in the TMJ. This is what allows the jaw to rotate. When we talk about the mandibular notch, that's the notch located between the condyle and the coronoid process. The coronoid notch is the greatest depression on the anterior border of the ramus. It's a landmark for the local anesthesia. It's where you do the inferior alveolar block. I realized I think I completely forgot to do the coronoid process, which is the interior superior projection of the ramus of the mandible. This is where the temporalis muscle, which is a muscle of mastication we'll be talking about in a couple of weeks, inserts. So it's for muscle attachment. So hopefully this will not move, but if we look at, of course it moved, right here is the coronoid notch. This is the greatest depression on the anterior border of the ramus. This is a landmark when you're giving an inferior alveolar injection. So if you were to, again, take your finger right by the retromolar pad and move out toward your cheek, you could feel that most interior ridge, which is the coronoid notch. We also, you'll note the lingula, which is a bony spine overhanging the mandibular foramen. Again, I'm going to try to move my, I wish this wasn't so sensitive. When I move my mouse, right there, that's the mandibular canal. That's where the inferior, think of bottom, mandibular, alveolar goes into the bone, nerve. So the inferior alveolar nerve enters and exits right there. So again, the lingula is the bony spine overhanging the mandibular foramen. This serves as an attachment for the sphenomandibular ligament, which is associated to the TMJ. So again, the lingula, the bony projection, it's associated with attachment for a ligament for the TMJ. The mandibular canal is where the inferior alveolar nerve enters, and it travels in this mandibular canal right in here. There's the submandibular fossa. I'm going to stop using my mouse for a minute. The submandibular fossa, if you look, it's inferior to that, to the canal. Fossa, so that's the depression. Submandibular fossa is where the submandibular gland is located. The mandibular canal, again I mentioned, is where the inferior alveolar nerve and blood vessels travel in this canal. Okay, if you take a look here, it gets a little confusing with 3 and 4 at exactly what they're looking for. But take a look at, here's the lingula, here's the mandibular foramen, the mandibular canal. So if you said this is the condyle, you're correct. Mandibular notch is between 1 and 2. Coronoid process, that's where the temporalis muscle is attached. 3, what it's pointing at is a submandibular fossa. Also 4 is the mylohyoid line, which is point of attachment for the mylohyoid muscle, which the mylohyoid muscle forms the floor of the mouth. Again, the mental foramen, mental protuberance. Now if we go to the posterior view, you can see see if you can find where the lingula is, mandibular canal. Mandibular foramen. Again, this particular one, they're saying the 4 is the mylohyoid groove. Above it, or superior to it, would be the mandibular canal. Sublingual fossa is where the sublingual gland is located. Again, we'll be talking about glandular tissue later in the semester. Also, we didn't talk about the mental spines, number 7, which are also called genial tubercles. The genial tubercles are used as a point of attachment for different muscles. Here's the lateral aspect of the mandible. Keep in mind the inferior border of the mandible. That's if you were to take your finger and find the angle of the mandible and then run your finger right underneath along the line of the mandible. This is the inferior border. This is going to be important to be able to palpate when you're doing your extraoral exam, as well as when you're locating different landmarks. So inferior border means below. Nasal bones, I think it's pretty clear that forms the bridge of the nose. The vomer with the ethmoid bone, the perpendicular plate of the vomer bone, form the nasal septum. The vomer has no muscle attachments. Inferior nasal conky, I should say, are separate facial bones. Remember that there's also a superior and middle, which is part of the ethmoid bone. But inferior nasal is by itself, it's a separate facial bone. It projects off the maxilla. It's shaped like a scroll. So if we were to take a look at the lateral wall of the nasal cavity, see if you can figure out these different bones. 1 is frontal, 2 nasal. 3 is not a bone, it's just the cartilage. 4 is the maxilla. If we're looking at the maxilla, they're pointing to different things. Basically, the frontal process, the incisive canal. Remember, that's where the nasal palatine nerve travels. The palatine process and the alveolar process. When we look at the palatine bone, they're pointing to the perpendicular and horizontal plates. There are 2 plates. The sphenoid bone, pointing to specifically the sphenoid sinus, which is an air cavity. Again, we'll be talking about sinuses later on. Also talking about the medial and lateral plates of the pterygoid process. Remember, these are points of attachment for muscles of mastication, more specifically the medial and lateral pterygoid muscles. And also the pterygoid hamulus, which again is for a point of attachment, and oftentimes you can see that little curved projection in a radiograph. Ethmoid bone, showing the middle nasal conky, the cribriform plate, and the superior nasal conky. Palatine bones, remember that the roof of the mouth is formed by the maxilla and the palatine bones. The reason why it's considered a facial bone is because you can see it forms a very small part of the apex of the orbit. The zygomatic bone, again, if somebody were to say that they broke their cheekbone, this is what they broke. Odds are, which is the zygomatic bones. It's composed of 3 processes, the frontal, temporal, and maxillary. The frontal process of the zygomatic bone forms a portion of the orbital wall. The temporal forms the zygomatic arch together with the zygomatic process of the temporal bone, and the maxillary process forms a portion of the infraorbital. Infra would mean below, orbital rim, and a small portion of the lateral orbital wall. Here's just another picture of the zygomatic bones. Lachrymal, think of lachrymal, think tears. This forms a small portion of the anterior medial, it's the most anterior medial bone of the orbit. Nasolacrimal duct is formed at the junction of the lacrimal and maxillary bones. Tears are drained through this duct into the inferior nasal meatus. Okay, that's it for your bones. Let's review a bit. If you were to take a look at this, see if you can identify these areas. Now remember, number 2, supraorbital notch or foramen. Remember that is supra, above the orbit, versus number 6, which is below, so it's infraorbital. Okay, hope you did well on this. You can kind of see the processes of the zygomatic bone right here. Great. All right, so now if we were to take a look at the midsagittal section, see if you can identify these bones. Remember, on number 1, they're looking at the sphenoid bone, but they're looking at the greater and lesser wing, the area called sella turcica, and the sphenoid sinus. Remember, the sinus is the ear space. 2, the frontal bone. They're also pointing to, if you can look, there's a little space there, that's the frontal sinus. On number 8, the temporal bone, they were pointing to the squamous and petrous sections. Okay, see if you can identify these areas of the mandible. Okay. Okay, if we were to look at it, try to give you a little time. 1 would be the condyle. 2 is the neck of the condyle. 3 is called the pterygoid fovea, which is basically just a triangular depression where a muscle attaches to. If we were to take a look at 18, that's the mandibular notch. 4 is the coronoid process. If we look at 5 and we go a little bit lower, they're pointing to the coronoid notch. Again, that's the area that is a landmark for local anesthesia. You really have to come out a bit towards the cheek because it really protrudes out a bit. We're looking at 7, we're looking at the angle of the mandible. 13, the inferior border, mental foramen. 10, 8 is the alveolar process. 9, they're pointing to the body. 16, the lingula. 15 would be the mandibular foramen. which is where the inferior alveolar nerve and artery enters, I should say. 17, they're actually pointing to the mylohyoid line. Remember that above that, superior to that, is the mandibular canal, which is where that nerve runs through. 12, I don't believe I said, is the mental protuberance. This is the area again, just a different angle. Number 25 we didn't talk about, but that is the genial tubercles or the mental spine. Again, this is where there's a muscle attachment. Okay, if you were to look at the superior view and we take a look at all these different foramina, I wouldn't get too worked up over it, but there are some that are very important to dentistry. You should have an idea where all of these are, but when we start talking about nerves and all, I want you to have an understanding of where they enter and exit from the brain. And to back up a minute, if you take a look at the printable presentation of this, you can find all of the answers to the landmarks of the mandible. So the areas that I want you to really be concerned about would be, well, of course, 2, the optic canal. That's where the optic nerve. Remember that from the cribriform plate, that's perforated, that's an area in the ethmoid bone that seats the olfactory nerve bundles, so the sense of smell. But 3, 4, and 5 are important because these are foramen for the trigeminal nerve, which is really the most important cranial nerve in dentistry. Superior orbital fissure, that's where the ophthalmic nerve exits. Foramen rotundum, think of someone that's rotund, is the maxillary division of the trigeminal nerve, and the foramen ovale is the mandibular division of the trigeminal nerve. Foramen ovale, man loves ovaries. I remember 3, 4, and 5, these different foramen as standing room only. Foramen spinosum is where the middle meningeal artery and vein and the meningeal branch of the mandibular nerve enter. The carotid canal, 8, is where the internal carotid artery and internal carotid nerve plexus. Should know foramen magnum, number 12, it's for the spine. Okay, the floor of the nasal cavity is formed by which 2 bones? If you answered B and D, palatine and maxillary, you are correct. Which nerve exits the cranium through the foramen ovale? Remember that ridiculous mnemonic I gave you? If you did, then you'll remember it's the mandibular nerve. More specifically, it's the mandibular division of the trigeminal nerve. The external auditory meatus is found in which of the following bones? So where would you find the foramen, the opening for the ear? If you said the temporal bone, you're absolutely correct. The cribriform plate is a portion of which of the following bones? I already kind of tipped my hand here by telling you earlier that it would be D, the ethmoid bone. It lies in the anterior cranial fossa and is the opening for the olfactory nerve to enter the superior aspects of the nasal cavity. Okay. In addition to this week's learning activity you can find online, be certain to look at the skull identification section in the learning guide. This guide should reinforce what you know and help to clarify what you don't. And at the risk of sounding like I'm teaching kindercare, I think it would be in your best interest to get some colored pencils and just color in the various bones so you have a clear understanding of the identification of these bones, because this we're laying the groundwork for the rest of the semester. When I talk about the occipital nodes, you're going to know that is the base of the skull, the occipital bone. So it's a building block. Unfortunately, you have to start here and we'll keep building. So also note that there is a skull on reserve at the library. And should you have any questions, concerns, feel free to email me, post it on the discussion board, or come see me. Thank you.